Hi, my name's Megan. I'm a pharmacist for Chartwell Pharmacy. I'm here today to talk to you a little bit about Krystexxa therapy. Krystexxa is a medication that is utilized for uncontrolled gout when other therapies such as allopurinol or febuxostat have not worked to lower your uric acid levels. With Krystexxa therapy, it's recommended to utilize a medication called methotrexate. Methotrexate works for immunomodulation, which just means that it helps your Krystexxa work better and it decreases the risk of side effects associated with Krystexxa therapy. With methotrexate therapy, you will also be prescribed a medication called folic acid. Folic acid is a medication that helps decrease side effects associated with methotrexate. When starting Krystexxa therapy, it's recommended that you start your methotrexate therapy 4 weeks before your first Krystexxa dose. Additionally, it's recommended to stop medications like allopurinol or febuxostat approximately 1 week before your Krystexxa therapy. If you are on allopurinol or febuxostat, it's important to talk to your pharmacy and your physician to create a plan for stopping that therapy. Chartwell Pharmacy will be dispensing your folic acid and your methotrexate in blister packs shown here. Folic acid is given once per day in the morning, which you can see in this column here. Methotrexate is only to be given once per week, and we will be giving that on Wednesday evenings. It is important to take all tablets of the methotrexate within this blister pack at the same time on Wednesday evenings. Methotrexate is considered a high-risk medication, which means that if you do not take it the way it is prescribed, there's a risk of certain adverse events. So to summarize, your folic acid is once per day in the mornings, and your methotrexate will only be once per week on Wednesday evenings. If at any point in time you take an extra dose of medication or skip a dose, it is important to call the pharmacy and or your physician to notify them and create a plan moving forward. To review some side effects of methotrexate, it's generally well tolerated. However, you can develop diarrhea, rash, fevers, or chills, very common symptoms associated with other therapies. More severe side effects associated with methotrexate include abnormal bleeding and or dark stools. Your physician may order routine labs to monitor methotrexate therapy and make sure that you are not having any side effects. Additionally, methotrexate can increase your skin's sensitivity to the sun, so it is important to always wear sunscreen if you are going to be out in the sun for prolonged periods of time, as well as a hat and eye protection. With your first dispense of therapy, Chartwell Pharmacy will also be sharing this information guide for methotrexate. This teaching sheet will cover information, part of what we reviewed today, as well as some additional information that will be important for you to read. It is front and back, and if you have any questions associated with this therapy, you can always call a pharmacy. To summarize, you will be receiving methotrexate therapy in combination with your Krystexxa to help your Krystexxa work better and decrease side effects. Methotrexate will be dispensed in a weekly blister pack shown here. Your folic acid will be given once per day in the mornings, and your methotrexate will be given once per week, ensuring that you take all tablets within this blister pack on that weekly dose. You will also notice here that your tablets will likely not look the same, but you will receive an information sheet that describes what your tablets will look like. If you have any questions at any time, please do not hesitate to call a pharmacy for clarification. Our phone number is 1-800-755-4704. Have a great day.